There are 1.4 million cases of cancer detected in India each year. That's nearly the population of a small state like Goa. But with rising cases, India is also set to become the cancer capital of the world. Why is this happening? It's largely due to lifestyle changes, tobacco usage, poor dietary habits, and inadequate physical activity. It's estimated that around 2.5 million people in India live with the disease. But how does one tackle this new epidemic in a country that's poised to become the cancer capital of the world? How does one remove myths and create awareness and empathy? And then there are statements like the recent one by former cricketer Navjot Singh Sidhu, who said how lemon water, raw turmeric and garlic helped cure his wife from stage 4 breast cancer. How does one stop the misinformation and wrong treatment in these days of social media? Joining me to discuss this, I have with me Dr. Sushma Bhatnagar, Chief of the Dr. B.R.A. Institute of Rotary Cancer Hospital and the Head of the Department of Onco-Anaesthesia and Palliative Medicine at the AIIMS, New Delhi. Dr. Shelly Batra, who's CEO, Every Infant Matters, and the Head of the Department of Obstetrics and Gynecology at the Batra Hospital. And in the studio, I have with me my colleague, Lakshna Gulati. Lakshna, over to you first. You just put together this documentary on cancer. Tell us the kind of damage that Navjot Singh Sidhu's statement that his wife had recovered from stage 4 cancer. What kind of damage has it done to the cause of cancer awareness? Do people believe that that's the truth? Because a number of cancer hospitals have come out with statements condemning his miracle cure.
Okay, so to put things in perspective, we are a nation of over 1 billion people.
Yes.
India is said to be the cancer capital of the world, right? And then we have, and cancer is something that can affect anybody.
Yes.
That's what the doctors told me.
Right.
Right? So now when you have a person who's he's a public figure.
Yes.
He's in a position where he's got over 1 million followers on
Yes.
YouTube, on Instagram, and he's in a position where he can influence people,
Right.
When there's already probably not that much awareness,
Yes.
there is a lot of stigma, there is a lot of taboo. So in that context, saying things like, it's just, yes, there are herbal remedies,
Yes.
but then that is not a substitute for a scientific, proper treatment.
Right.
And his wife was suffering from stage 4 breast cancer.
Yes.
And all the doctors who I interviewed for my documentary
Yes.
said that there is no one, cancer of the
Right.
breast. There are over 100 breast cancers.
Yes.
And it's very specific to the individual. Some are hormone based,
Yes.
some are not hormone based.
Right.
There are aggressive type of breast cancers. So it depends on a person's molecular biology.
Yes.
That's why they do biopsies,
Right.
right? So in a context like that, a statement like this is not only damaging,
Yes.
it takes back cancer awareness programs decades.
Dr. Batra, we've all seen that statement by Navjot Singh Sidhu on social media. It was trending and it was a subject of much debate a few days back. How has this really damaged the cause of cancer awareness in India? Because we're hearing instances of people going up to doctors and asking them, can I use a similar cure for, stage 4 cancer, turmeric and hot water?
Very good question. Thank you for that. Let me begin by saying that the word cancer itself is cataclysmic. Anyone who even talks about cancer has a lot of fear. There's a lot of trepidation in the heart. And I've been in practice for more than 4 decades. I've seen so many people coming to me with, say, small breast lumps.
Yes.
And the big fear is, oh, is it cancer?
Right.
Doctor, what can I do about it? So I feel that all of us, we have a responsibility to the nation, to the public, you as media persons,
Yes.
me as a doctor, and our responsibility is to guide them on the right path.
Right.
What is cancer? How to prevent cancer? And let us focus on these 2 aspects fully. So what I have done always is to talk about cancer in a very non-judgmental manner.
Right.
And I have always told people, I've always told women that, see, you are women.
Yes.
If you're afraid of cancer, maybe one should not be afraid, but maybe there is something good there. If you are afraid of cancer, let us find ways and means of preventing cancer.
Yes.
Let us be positive about it. Now, the challenge we are facing these days is of many things. You've rightly talked of sedentary lifestyle, obesity. All these lead to cancers, like cancers of the breast, the uterus, the ovary.
Yes.
And there's one more thing I want to add here. Late marriages, delay in lactation, these have also been held to be responsible to some extent. So
Right.
now, this is what life is all about.
Right.
Women are going to get married late, they are going to take up jobs.
Yes.
We cannot stop that. We are going to be sedentary in most of our times, but if someone is there, someone from the media, some celebrity can say, okay, get up, move,
Yes.
walk 6,000 steps a day.
Right.
When you're talking to your friends, pick up the phone and walk. And just cut down on the junk food.
Yes.
Eat healthy and do your breast self-examination. Do your annual checkup. I think these little messages will go a long way in timely detection.
Yes.
Many cancers are all about timely detection.
Right.
Prevention itself is linked to timely detection.
Prevention is
breast cancer,
yes,
if it
of
comes,
course.
the patient comes late, you can do
Yes.
nothing.
Right. Dr. Bhatnagar, this, we are also seeing a lot of people, apart from the self-help ideas that we were just talking about, social media, celebrities, influencers putting out what they believe are cancer cures. Is there a larger challenge when it comes to looking at the disease, where we are talking of, social taboos attached to cancer patients? Is that also a big issue for you?
So I think it's a very good question. Regarding the social taboo, I want to start right from the beginning. The biggest challenge in our country is most of our patients present in advanced stage.
Yes.
And when we ask them why they are in advanced stage, so there is a lack of knowledge and lack of understanding at all the levels.
Right.
First, it is a stigma that most of the time female, they keep hiding if there is a lump in the breast, or if they
Yes.
are having excessive discharge per vagina, they keep hiding. This is one of the stigma, and they don't want to share with their family members. And finally, when they present in a very, very advanced stage. But
Right.
it is not only those females, those who are finding it a stigma and they are not disclosing, but there are many steps, like when they are going to the primary healthcare physician, or when they
Yes.
are going to any PHC or CSC or district doctors,
Yes.
they are also dealing. There is a lack of knowledge and lack of understanding at their level also. Most of the time, when especially carcinoma breast patient, when we see that they come with incomplete surgery.
Right.
Sometimes we find that they have not sent for histopathology examination. They just remove the lump, but they have not sent it for histopathology examination. So all these means, like, we have to improve this knowledge right from the beginning. And
Yes.
according to me, this knowledge should be increased from the school level. I think if we will start the understanding of prevention knowledge right from the schooling level,
Yes.
this will go a long way. Means, like, as every school child will understand that what is the importance of preventing breast cancer, what is the importance, because these are the two important cancer amongst female, breast cancer and cervical cancer, which
Absolutely.
can be completely curable. Similarly, for cervical cancer, if we will improve this knowledge that less than 14 years of age, all the girls should go for vaccination. Now, vaccination, even if it is free of cost available, people are not still understanding the
Yes.
importance of it. So right from the school level, college level, means, like, we have to improve the
Awareness needs to
understanding.
be, absolutely, awareness needs to be
And
inculcated,
also,
Lakshna, yes.
So I asked this question to the doctors,
Yes.
why is it that there is so much stigma attached to it,
Yes,
right?
and is that also connected with the late detection of the cases?
The thing was that earlier we didn't have that many treatment options. There
Right.
was not, there were not too many good options available. Treatment was very expensive. There were not so many options
Yes.
available, and there was because people were coming later.
Yes.
There was a lot of disfigurement. There was a lot of,
Right.
all of that. I mean, that contributes to a lot of fear,
Yes.
right? That if oh my God, I'm going to lose my hair. Oh my God,
Right.
I'm going to, this is going to leave a physical scar on me. surgery, right? But now, and this is why awareness, it's a very human instinct.
Yes.
You fear the unknown,
Yes,
right? So
course.
which is why awareness levels, awareness drives at school levels, at college levels are important.
Right.
Because now you know that treatment is not that expensive. Even
Right.
if treatment is expensive, there are other good financially viable options available.
Right.
Second, it doesn't. So, for example, if there is a breast cancer which is detected at a very, very early
Yes,
stage,
yes.
that's what the doctors told me, that you just go in for a surgery. You
Yes.
probably don't even require
So
chemotherapy or radiation.
it's really important, Lakshna, what you're
So-
saying is that you need to demystify the whole cancer
Exactly.
thing and, treat it like any other disease.
And it's a very
not
human thing, right?
Yes.
That, oh my God, कैसे हो गया,
Right,
क्यों हो
right.
गया?
It's
So
death.
we need to
Cancer equals
normalize
death.
it,
Yes,
right?
normalizing it
And
is important.
Exactly, and we need to not make the cancer patient feel like a pariah,
Yes.
right? Because, and this is a fact, only 5 to 10% of cancers are genetic or hereditary.
Right.
Cancer doesn't spare anybody.
Right.
Like one of the case studies I interviewed, she was a healthy 37-year-old. 37-year-old.
Yes.
Also, a very important fact, the reason we are becoming cancer capital of the world is
Yes.
because we are getting detected with cancer at 5 to 7 years earlier than the Western world. That is what is happening.
That's worrying
so
indeed,
that's
Lakshna.
very worrying.
And when you say cancer capital of the world, and you're talking of the surge in the number of cases of detection or the rate of increase of cancer cases? What exactly qualifies us for this?
This is a surge because there is more awareness coming up,
Yes.
right? So, for instance, if a mother is getting diagnosed with
Yes.
breast cancer, the doctors automatically condition the first degree relatives,
Yes.
right? Like the daughter or the sister to do regular checkups, right? So, there is a little more awareness on that level, and B, unfortunately, it's driven by our lifestyle.
Yes.
That's something that the doctors
That was
emphasize
a bit of an
again and
eye-opener
again.
as well.
Exactly. Now, for instance,
dietary choices. That we make. Yes.
ultra-processed diets. If you
Yes.
look at our diet,
Yes.
most of us consume very, very unhealthy diets,
Yes.
right? How many of us are actually going home and cooking food every day?
Yes.
You are relying on ultra-processed diets to get you through,
Yes.
your day. Smoking, alcohol,
Yes.
there's so many. You can cut down the percentage of cancers by almost 40% if you
Right.
just if you stop,
Stop smoking and drinking.
Stop smoking
Absolutely.
and drinking.
Yes.
So these are just simple things that you can do.
Yes.
And that is I think being healthy is a choice, and
Yes.
you need to be aware. You need to, again, like, cancer is not something you should fear.
Yes.
Just by taking simple steps, just by being aware,
Yes.
just by going in for timely screenings, you can probably emerge.
You can make a difference.
You can make
Absolutely.
a difference.
Yes,
yeah.
yes. Lakshna, and Lakshna has meanwhile, she's done a story on India being the cancer capital of India that's dropping today on the News9 Plus app. But thanks very much, Lakshna, for that story, and of course, Dr. Bhatnagar, Dr. Batra, for telling us that cancer is not the death story that we all believe it is. There are several myths around cancer that need to be repudiated, and of course the biggest one is that cancer can be treated at home with home remedies, and that is something that we've looked at with great alarm. But thank you very much, ladies, for joining us on this topic of India's cancer surge.